This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Welcome to another edition of Health Watch. By the way, it's 8:04.
Yes.
8:04. If you didn't set your clock ahead, well, you might miss our show today.
Absolutely, John.
We are here in another edition of Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And today here on the program, as we do every week, we discuss the who, what, when, where, why, and how of Innovative Medical Associates. And if you have questions for Dr. Molly, or if you have a medical challenge that you want to run by her, feel free to call in at 855-839-1210, 855-839-1210. It's always a good day to get healthy, whether you change your clocks or not.
Hey, John, you know what? How many of our listeners today are tired, do you think? Huh?
Yeah,
if they manage to get up. I
many.
believe it. I believe it, brother.
So tell us about Innovative Medical
Sure.
and what you do and why
Sure.
it's different and how it's
Sure.
different.
This is always so interesting because it's very difficult for us to get across exactly what we do at Innovative Medical Associates. First of all, we are a group of like-minded providers. That means that we all share a philosophical outlook as to how we would like to use primary care and preventive medicine. So everyone works out of my facility, which is a licensed primary care facility in New Jersey. And one of the things that our philosophy is really, it's very important to the philosophy of the clinic, is that we want to use God's ingredients as much as we can to augment patients' care. So, for example, we believe that if you need an antibiotic, if you need a blood pressure medication, of course we can prescribe that, and our doctors do. But if there's a way by which we can limit those prescriptions so you're not doubling up or tripling up on your medication by utilizing natural product, that is our philosophical difference, John.
You don't really want to have side effects, and that's why
right.
That's why you have natural products
Exactly.
in this mix.
Exactly. And the side effects sometimes are worse than the condition that the people presented with. Have you seen the labels in some of them? And now we have a bunch of new ones that are coming out that we're not even sure what those side effects are going to be. So, for example, if you have a problem with your cholesterol, we have some natural products that we can use to augment the drugs. And you know yourself, you had several problems with several pharmaceuticals that you were put on.
That's right.
And unfortunately, we see a lot of that.
So your whole goal here is to prevent
Or
side
minimize-
effects or
minimize
minimize
them.
as much as you can.
And without putting the patient at risk. And the way we deliver our nutraceuticals is through hydration.
Okay, that leads me to the hydration. And how do you know, or how do you determine what goes into what?
Well, that's the art of this. Okay, that's really the art of this, and that's where I come in. We determine this, of course. There are some standard hydration protocols, but we are not a spa. Don't come to me. You can. I mean, listen, I'm not going to turn you away. If you have a headache from drinking too much and you come in, I'm going to be compassionate and get you back in line. But the bottom line is we're looking to effectuate change in your life in terms of actually helping you control whatever medical challenges you have, or in addition to that, just controlling a healthy lifestyle for you to prevent some other types of conditions. So, how do I decide what you get? Well, the bottom line is you're going to come in, you're going to see myself, we're going to sit down, we're going to talk about your particular problem, and based on that, we're going to develop the protocol for you.
you have about over 600
Right,
protocols.
exactly.
So the likelihood that you have something for whatever the condition happens to be is probably high.
It is high. It is high. And you know what's interesting? We're seeing more. Well, I can tell you the top 5 things that we're seeing anymore, John. I tell you what, there are people who come in with the cardiac problems, and you know and I know that we absolutely were able to control cardiac issues from the very beginning 27 years ago in October.
Oh, I remember that.
Cut our teeth on
Oh,
those.
yeah.
And so we're still seeing those kinds of issues. We're also seeing people with hypertension, high cholesterol, you name it, we've seen it.
And of course, COVID.
Oh, my God. We're going to touch on that again today because I feel like COVID's never leaving
No.
us. Okay. So, yes.
And the
yes.
media doesn't want to leave us either.
Yeah, I think I'm to a point where even if you don't have COVID, you think you do. It's incredible, John.
Okay, so whatever your condition happens to be, how many treatments
There it is.
should you expect before you can see change?
Well, I would say you can start to see change in as little as 5 treatments, but to actually effectuate that change, and to get you back is going to be dependent on how long you've had your problem. I had a patient come in with stage 4 cancer, and of course they listened to the program and they said, "Well, Dr. Molly, I'm going to, lick this thing in 5 treatments." I said, no, you're not.
No, you're not.
I said, did you lick it with the conventional treatment in 5 treatments? Well, no, it was 4 rounds of chemo every day. Yes, that's right. And the same thing is true with this. It's going to take a little bit of time for us to see where you are and then to matrix it out. But I'm going to tell you, people start to feel better, function better after 5 treatments. And that, my friend, is part of our goal.
And you have many testimonials to that.
Oh, yeah, I'm going to read a letter today.
Yeah, later on, we're
Yes.
going to read that. But it goes without saying that you do, you couldn't stay in business if you're not getting results.
Oh, we're
And
getting
you're
results.
getting
And
results.
and the key to this is sustainability, John. I think one of my patients last week said it right. You don't just come in and think you're going to get one treatment and you're going to walk on water. You remember John called in. He was a great guy. You know that that's going to be the issue. You just can't do it.
Okay, we have a call early here.
Wow, I like that.
Jim from Wilmington has a question. Jim,
Hi-
good
hi,
morning.
Jim.
You're on Health Watch with Dr. Molly.
Good morning, Dr. Molly.
Hi.
I just completed a 2-year treatment of prostate cancer.
Yes.
So,
God bless you. God bless you.
Thank you. There's different treatments. So I've had it go to my lymph nodes, and so I had radiation, which I completed a year ago, and I was on Lupron.
Yeah.
As I know some people have the seeds, so I just wanted you to understand, that's
Sure.
the treatment. And then I was also on this other abiraterone, I believe it's called.
Sure.
So now everyone is just telling me that, okay, you have to just wait for a year to get your strength back, and the drugs that are on, they make you, obviously lose your testosterone, which
Of course.
then you lose
of course.
muscle mass, and then you lose retaining water. So
Oh,
it's-
wow. This is interesting. I would tell you, come up and see me for the free consult. I think we can help you recover a little more quickly than the year, okay, a little more quickly. And I think it's really important that you continue some type of nutritional or functional medicine treatments while you're waiting this year. Everybody, wait a year, come back. Oh, the other thing is, I'm a firm believer, and again, I'm the PhD doc, I'm the clinical chemist. I'm a firm believer in looking at making sure that the cancer markers don't rise during this year, on an ongoing basis. And for the most part, that's conventional, my friend. It can be covered. You have a history of this thing, and you want to look at some of the cancer markers as it goes on. You don't want those rising after you've had the kind of treatments you've had, including the Lupron. There's also a lot of nutraceuticals, and I'm talking about utilizing them with the hydration, that can not only make you feel better, but possibly keep you from having an additional problem. You know what, Jim, you've really done a good course here. I don't like the idea that it was in your lymph nodes and they, of course they had to radiate the lymph nodes, and I would want to keep those lymph nodes flowing, and we actually have a protocol for that utilizes a homeopathic as well as utilization of vitamin C. Please give my office a call. I can't go into that specifics, but I would love to with you, okay? How old are you, by the way, my friend?
69, almost 69.
You know what?
He's a
You
baby.
are a baby compared to John and me. Come on, man. You got a lot of living. You want to enjoy life. That's the thing.
I know, and I'm
I mean,
working out like 5 days a week.
God bless you.
I mean,
bless you.
and
got
I want to try to get back to normal and get rid of these stupid we got hot flashes.
Yes, I understand that, and there are things that can be done. And it's an interesting thing. The conventionalists, they absolutely believe they got to reduce that testosterone. And there's some data to support that, but I have so much literature to give you that I think you'd find it very interesting about this. God bless you,
Jim,
my
thanks
friend.
for the call.
Hey, Jim,
and we
thank
appreciate
you.
it. And make sure.
Thank you for accepting my call, and have a good week.
You too.
Thanks a lot.
That is a very interesting call.
Yeah, and he is definitely a candidate for your cancer support.
Oh, my gosh, yes. And you and I both know we've had this conversation with many of the men in our office.
Yes.
And the interesting thing is they blast that testosterone, and the Lupron, of course, takes you to the other side. The thing is, I had one gentleman who said to me, now I know what women go through with these hot flashes, and it is true. But there are so many ways, homeopathic ways, I might be able to help him reduce that and also, get him back to feeling good. He's working out. This guy's really wants to get back to life. I agree.
We are coming up on our first break of the morning. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 if you want to get in here and have a question for Dr. Molly or a medical challenge that you want to run by her. 855-839-1210. Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. Dr. Molly and I will return after these words. We are back here on Health Watch, and as always during the program, operators are standing by at Innovative Medical Associates, and if you want to set up that initial consultation with Dr. Molly, you can do that right now. 856-489-0505. 856-489-0505 is the number. As I said, call and set up that initial consultation with Dr. Molly. It is complimentary. And, of course, there's the website, InnovativeMedicalAssociates.com, InnovativeMedicalAssociates.com. A lot of good information on the website. Check it out, InnovativeMedicalAssociates.com. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. The number here in the studio, 855-839-1210, if you have a question for Dr. Molly. You have a very interesting email, and you got it this morning. Yeah.
I got it this morning before our show, which I was really happy about. So the email was addressed to Dr. Molly, and it says, this was a patient of mine who had liver cancer, actually, which was pretty severe. So he writes and says, it's been over a year now, and I've successfully completed my traditional cancer treatments, and it's been confirmed that all of the cancer is dead. I want to express my gratitude to you and your staff for your helping me with my cancer fight with all your treatments, with your advice and counsel. And over the past year, I put together a summary. And he goes on to say some of the things that I had said to him to do. But, I want to address how he says, all the cancer has been confirmed all dead. I would prefer to say that at this moment he's cancer free. And why am I saying it like that, John? You know why.
Yeah, I know why.
Because I am of the firm belief that many times these cancer cells are rogue. They're in our body. The idea is we've got to go back to the immune system and keep it tuned up through all of this. So he had all of these traditional cancer treatments, which I applaud. He needed to do this. But what I'm saying is, don't become cavalier about that and think, well, I'm done this. The cancer's dead. It's, good. I have great luck. It's great. And maybe you do. But what I am saying is, if you don't change many of the lifestyle issues, if you don't come back in for your tune-ups and get more of the vitamin C and several of the cancer protocols, depending on your type of cancer, the chances are you could indeed have a secondary site. The objective is we want to tune your own immune system up to continue a fight like Ron is doing right now.
So don't abandon treatment. Is what you're saying.
No, and I certainly don't even like the idea that they said the cancer is dead. My sense is that you're cancer-free in this moment. Remember, everything is a snapshot of a particular period of time. And look, John, you don't get cancer the day they find it. You've been brewing this for a long, long time. Okay, you and I hear all the cases. The beauty of you being a patient is you sit in there when we have a full clinic, and do you not hear the stories?
Yes, I do. Yes,
right.
I do.
And it's like, what are you kidding me? You've had these problems. I've had pain. I've had this. I've had these changes. And you let it go for what? 6 months, 2 years.
2 years,
what?
yeah.
Right?
Oh,
right?
Yeah.
And then
many times.
the next thing I know, you're in the emergency room bleeding somewhere.
Yeah.
And I hear the story. You don't do that. The idea is you want to continue to do the things outside my clinic, the advice and counsel that we give you, as well as come back and do not let your immune system be fooled into thinking, oh, yeah, the cancer's dead. I don't believe it.
So you're really saying that when the cancer is, you're cancer-free.
Right. In that moment, you are.
But you're take the necessary steps
to continue
That's
that.
Right.
That's
so that it doesn't come back.
Listen, in Europe, people live with cancer. They know that.
Yeah.
They have it. They live with cancer. I just saw statistics this week. Of course, we're one of the highest countries in the world with cancer, right? Interestingly enough, Finland doesn't have as much as we do. Could be related to how much the population is there, but I didn't get into that. I saw the statistics, and I said, liars figure, figures lie.
Yeah.
But the point is, what we need to do is what? We need to maintain our own immune system in tip-top shape in order to go after any of these rogue cells. And the lymphatics, interesting, the gentleman who called earlier, the lymphatics are very, very important post your cancer treatment. And believe me, we want to keep those operational.
All right, 855-839-1210 is our number here in the studio, 855-839-1210. If you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210. So you've had, in the past couple of weeks, you've had people from Ohio, Indiana, Kentucky,
Princeton, everywhere,
They come
New
from
York,
all over.
New York,
There's a few locals like us.
Yeah, Philly, I consider that our local, stomping ground, John.
But the question is, they come from all over, but
right.
How do you follow up with them after they leave?
Well, that's a great question. Well, I think we invented telemedicine prior to when telemedicine
Right.
was there. We actually Skype in to see these patients, and we do it on a once-a-week basis until we're sure that the patient has stepped down in the protocol, meaning they're taking the orals, they've changed their actual lifestyle situation, and then we follow them by phone and by Skype, and we do this for 3 months until they either come back for their additional follow-ups 3 to 6 months later, and that is done. So yes, we follow the patients afterwards because sometimes we're sending them some of their particular products that we want them to be on that they can't get in their local market. Not that we don't sell product, as you know, John.
Yes.
But we'll help them secure that product and make sure they get it. We'll get them on a on a situation where it gets delivered to their house directly, etc. So the service doesn't stop when they leave.
So how often do you do this telemed?
Once a week, at least in the beginning for the first month. Then we might go down to once every other week. Finally, at least maybe twice a month until they come back, say in 6 months or 8 months.
And that's usually, is that the
That's
norm?
usually
6 months?
yeah. That's usually, and again, it's going to be dependent on what the reason was that they came to us, right? Obviously, if a patient comes to us with a chronic condition, like let's say an autoimmune condition, they may come in 4 months. But if they've come to us for a tune-up because they're not feeling quite right, or they have fatigue and they have some situation where we have to help them, they want to get off of some meds, and the docs have to get involved with helping them reduce the meds and putting back in some of the natural substances, that might be a little quicker. But we also want to stay on top of that because we don't want the patient at risk, even though they're not in our backyard.
Why do they come to you? Is it because they can't get that where they are, or they've heard about you? Or...
I want to believe they come to us because they know that my clinical staff, all of my help, et cetera, is just like this gentleman who wrote the letter said. They're great, and as a result, we do good work. And so word of mouth, and they also can get referred from their own doctors many times.
So your referral network is far and wide.
Yeah, it is. It is.
So,
it is. It actually is, John.
What's the furthest you ever had somebody come from? To
California,
see you?
I guess.
Yeah.
Yeah, and she still does.
Yeah.
So yeah, we've seen it all.
What was that TV show, Spanning the Globe?
I don't know about that, man. I don't know about that. But you know what I find interesting, John? People will travel all over. Saw this terrible case this week for medical care in Mexico,
Yes.
right?
Yeah.
Right?
And we're going to talk about that after the break. But
Okay.
That's
But there it is.
interesting, yeah.
But there it is. So people will travel to Europe. Well, they figure, why not travel to New Jersey right outside Philly?
You're right.
You know?
That makes more sense.
Yeah, sometimes it does.
Okay.
Sometimes it does.
We are at the halfway point of the show. Our show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. If you have a question for Dr. Molly or a medical challenge, 855-839-1210 is our number here in the studio, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return. More show after these words. And we're back here on Health Watch. Again, operators standing by at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. You can call them now, or you can call them after 9 o'clock, because they will be there when we leave the airwaves, or they'll be there all day. 856-489-0505 is the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Check that out. A lot of good information on that as well. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. If you want to get in here with a call or a question for Dr. Molly, feel free. 855-839-1210 is our number here in the studio, 855-839-1210. And speaking of far and wide,
Yes.
Dr. Molly, you had a patient that went to Mexico.
Right.
And I've always wondered,
Like,
why do people go? And
Yeah,
because
and-
it presents some other challenges.
It does. And,
So you want to talk about
Sure,
this?
I do, because this is that 30-year-old woman that I was telling you all about who had a genetic problem at birth, right? She's still living at home. She has some deficit, as I told you before. By the way, she's doing pretty well with the support of our clinic and the chemotherapeutics that are being done by one of my colleagues who is a friend, quote unquote, of the clinic, who is an oncologist, and we're working together on the case. But what I find interesting is, there was a huge splash in the papers and everywhere on the news about the people who went to Mexico for cosmetic surgery.
Yes.
Now, most of the folks who go there that we see go there for treatments, i.e. cancer treatments, and everybody's heard of this. You go to Mexico for treatments that you may not be able to get in the States. That's why they go to Mexico if they're in my clinic for the most part. And they also, or other people go for the cost. The cost is cheaper there. However, what I want to say to everyone is, when you go to a foreign country for your cancer treatment, Farrah Fawcett went to Germany,
Yes,
correct?
yes.
I mean, people hear that. And by the way, the Germans have a tremendous system out there. And anyway, I have a relationship with a German clinic, should people want to know about that. But here's the thing. Here is the situation. You have to utilize the laws and the customs of that particular country. Now, why am I mentioning this? Because I believe in personal and precision cancer care. And I'm talking about traditional care. And if you hear all the cancer places that, advertise, all the large systems, etc., that's what they believe in,
Yes.
right? And how do they do that? They base that on the genetics of the tumor for the most part. Many times they just talk about it and they just do a standard treatment for a particular type of cancer. But there are companies out there that actually culture and look for the cancer cells, and we have a relationship with one of them, and many times we'll request our patients to get another opinion on the traditional drugs that are being used for the chemotherapeutics, right, and the immunotherapies. So what do we want then? We want to get the slides that you've had from the surgery when you remove the beast, right? Which
Yes.
I always talk about. Get it out. If
Yes.
you can get it out, get it out. Well, in this case, I was talking to the oncologist who's doing the oncology for this particular patient, and I said, "Hey, doc, what did this test say, the genetic test say?" And he goes, "Well, I haven't been able to secure the slides. Maybe you could." Well, I started to look into this. Guess what? You can't, in Mexico, you, the patient, don't own the slides. Apparently, there's some obscure thing where they don't send it to the U.S. It's not your...
You're kidding, right?
I'm not kidding. And what this does is now, I suggested they call the consulate, but I don't know. I'm not a lawyer. I know where to send the slides to get the second opinions. I know all of that, but I can't do it if I can't get the slides. So this really took me back, John, and it gave me another reason to say to people, listen, throw caution to the wind when you look at going to these other places, because you want to make sure that you are able to get the tools you need for ongoing treatment, even when, quote unquote, their treatments, their traditional treatments, whatever that is, works for you. Because at some point, like I said, you want to be armed with information should, God forbid, the cancer rear its ugly heads again.
Now, why would you go somewhere, a foreign country? Is it because
I would say
they...
cost, and it would also be in a situation of the cancer or specific types of conditions, they're able to do certain treatments that are not allowed here in the States.
But is it really worth that?
I can't say
I really
no
don't.
or no. I mean, I've seen people who come back from these places and they're doing very well. But what I'm saying is, let's throw caution. Yes, you're doing well in the moment. What I want to do is make sure that the medical record is preserved, right? So that should you need additional care while you're here and you have an advocate like someone like me, I'm going to see to it that those slides and things go out for second opinions and everything. Right.
But they can't, because is that a law?
I don't know. I don't know. I'm reporting back to folks what my patients have told me. And I'm going to tell you, these are highly educated people, college professors, etc. What happened here, I do not know. But I wouldn't be surprised if you can't get it, because they just don't want to give it up.
Yet.
Bottom line.
I've often wondered, because people have told me I'm going to go to Guatemala and I'm
Oh,
going to go
yeah.
to the Dominican
I
Republic.
had a dentist. I mean, I had a lawyer who went to do dental work in South America and came back like a mess. So I don't know.
Yeah, I would just be afraid of that.
Well, I think I'm not saying to be afraid of it because they really do have access to a lot more, quote unquote, than we do. But what I will say is that, we're very competent here in the States. We have the best trauma in the world. I've always said that. If you're in any type of trauma situation, we have the best in the world. But, there are a range of many, many integrative facilities here in this country that I have some relationships with that we can get you to where you got to go and then follow up with you here back at our facility, which we do plenty of. And I'm not going to give away any of my cancer protocol or whatever. But, there are constraints in this country. There definitely are, John. Whether we like it or not, Big Pharma has a lot to do with our FDA. We all know this. And for the most part, is it good? I don't know. I'm neutral. But I will say this. You can find other ways to go about your cancer treatment. That's all I'm saying. And you always want to be armed with as much information from the beginning of your journey to where you are in the moment.
All right, 855-839-1210 is our number here in the studio, 855-839-1210. If you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210. COVID will never go away, I don't think, Dr. Molly.
Yes.
You have information about a study in London?
Yes, actually at the Imperial College of London. This is so interesting. They had something called the Human Challenge Program. Anyway, what they did is half of the people who participated in this became infected because they wanted to infect them. And despite literally having COVID placed in their nasal cavity, they were infection-free when they were tested. Then some of them actually tested positive for the COVID, but they didn't have any of the terrible symptoms. So these folks were looking for the genetic reason why. And I started thinking about this, and I thought, interestingly enough, I would think rather than continue to look exclusively for the immunity gene, why wouldn't we look at the real story about keeping all of your immune system up to par and maybe in excellent shape? Because, while going through COVID, we saw many people. We were allowed to be open because we were a primary care facility, and we took all the COVID precautions, et cetera, all that. I don't want to revisit that. But I want to say, isn't this interesting? Because you were there through this. Most of our patients did very well on an immune-enhancing protocol that did what? Started your own immune system to fight the thing.
And that's significant, really.
I thought it was significant, and I will tell you, that is the approach we take with cancer, autoimmune disease, and many other challenges. Because, as I said before, what God's given us, immunities. God's given us this. God's given us these white cells to help us do this, the job of treating or going after these foreign invaders, okay, which is why most of us tended to live a fairly good life. Yes, we get sick, but hopefully we recover. The question is, when does this cause a problem? When your own immune system is depleted, John.
You're talking here natural-born immunity?
I'm saying the people at the London studies were looking for genetic reasons for this. What I'm saying is, regardless of your genes, as many times I've said, it's also how you've treated your body, what we do, the anti-inflammatories, keeping your own immune system up to par and beyond. You want to keep your own immune system functioning because you have an innate ability to really fight these conditions. And the proof has been in my clinic.
Yes.
I said I'm going to send my charts didacted, of course, over to them because I think maybe they're going about it in a great way. I would want to know what that gene is. But you know what? I think regardless of whether you have this gene that has this fighting ability or not, I believe we all have the ability to tune up our own immune system and to keep us safe through many types of viral infections.
And that's really the basis of your clinic.
Exactly.
Is really boosting the immune system.
That's right. And you know what's interesting? Just about 90% of all of our cancer patients have a viral component when they come to me because we test for them. And interestingly enough, what does that tell you? Your immune system was fighting that virus, couldn't fight the cancer at the same time. But if you kept your immune system tuned up, would you have a better chance maybe at fighting
Yes,
You're
yes.
darn right.
Yes.
You're darn right.
That's right. And I never sniffed COVID. I mean,
no, please.
I mean, I don't want to. I'm going to knock
That's
on wood
right,
here.
because it's everywhere. But the point is, John, even with that right now, assuming that the way you take care of yourself in terms of coming in, taking care, getting the anti-inflammatories, taking all the lifestyle changes that we really pushed you to do, it's really helped you. Why do you think you recovered from the stroke so quickly?
That's.
I'm
that's
telling
really,
you something.
That's
one of the reasons is because we helped your body, we helped the brain with neuronutrition to come back a little more quickly. And yes, you have to do the physical therapy. Yes, you had to do the speech therapy. I agree with all that. But what did it do? It was helping the plasticity of your brain. My job was to feed that, and that's what we did.
Okay, we are coming up on our final break of the morning. Health Watch is the show every Sunday, 8 till 9, here Talk Radio 1210, WPHT. We still have time for a couple of questions, 855-839-1210, 855-839-1210. Last week we had like 3 calls at the end of the show.
I know. I know.
Call early so we can get to you, okay? 855-839-1210 is the number. And if you have a medical challenge or you want to have a question for Dr. Molly, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return with more Health Watch after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and the number, 856-489-0505. Again, 856-489-0505. You can call now, or you can call after we leave you at 9 o'clock, or you can call anytime today, but make the call and set up that initial consultation with Dr. Molly, and that's really where you can get the information you need as to whether you want to move forward or not with the program. 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Health Watch is the show, 8 till 9 every Sunday here on Talk Radio 1210 WPHT. A reminder, if you missed any of today's show, especially if you didn't set your clocks forward and you overslept, you can hear us again this afternoon. It's the Health Watch replay from 4 until 5 right here on Talk Radio 1210 WPHT. Want to talk about peptides and the weight loss program.
Oh, yes, sure. And you know what? You've seen the commercials all over TV. By the way, I've noticed now they're actually putting a little disclaimer about check your insurance first because you know why, John? That particular peptide in the that they synthesized, they made it a pharmaceutical, is so expensive. It is unbelievable. I mean, it
Really?
is. Oh, yeah. So maybe $1,500, $1,600 a month.
Wow.
Yeah, and they're not kidding. They're not kidding. Check your insurance first, guys. Anyway, we have a program that's similar. People should come in and talk about it. I can tell you that the thing I like about our program is you're going to come in once a week, get your shot, which it is once a week shot, of the particular peptide. And by the way, we'll go into a little bit about peptides after this. But This peptide, what it does is it works. It will cut your appetite, but you want to be extremely careful. I want to make sure that my patients are truly a candidate for this because we have to look at liver enzymes, and I want to do that on an ongoing basis. It's part of the program. I want to make sure that you're not losing any nutritional status while you're through this, because guess what? So now you've lost the weight, but in the meantime, you're falling apart because you're exposed to all these viruses out there because you ruined your immune system. Now we want to make sure things are okay. So our particular program has not just giving you the prescription, but actually making sure that you're a candidate for the prescription, that we monitor you for at least 8 weeks while doing the particular peptide. And by the way, we compound that peptide for us, so I believe it's a little better than getting the drug. It's the same peptide. I'm not saying that the drug is bad. I'm saying the drug is extremely expensive. And what I'm saying is that in you doing this, we're able to monitor the patient, and that for me is a big plus, and for my doctors are a big plus, because we don't want there to be, you lose the weight, you have other problems. We don't want that. We want this to be slow and steady, and we want to make sure there's no shift in your hormones. We want to make sure there's no problem with your gallbladder, with the entire GI tract. And we want to instruct you that this is going to make you feel full sooner. So we don't want you to overweight, and we may then be able to manage the side effects that come with that drug, which is nausea many times. So
this is a combination of the
hydration
and the hydration.
Yes, and
includes peptides.
Yes, and that's exactly right. So it is not quick. It's not quick. Our program is at least 3 months long, and you'll see me at least once a week.
And in that 3 months, how much should you expect to lose?
Well, I can only tell you what I lost, okay, which is about 39 pounds.
Wow.
Yep. You know it.
Yeah,
Everybody has said it to me.
Yeah.
But
in fact, I said to you one day, are you getting your suits taken in?
Yes,
because
I'm trying.
A few of your suits were still.
Yeah.
I said, you look baggy on you.
Yeah, they did. They do. They still do. First, I have to have the time to go set up for the tailor. But the point I'm making is it can be done, but you really want to do it safely. That's the point. And if you have comorbidities, the chances are that would be a covered process. But it's very difficult to get your patient approved. It's almost impossible.
All right, 855-839-1210, again, is our number here, 855-839-1210. Speaking of peptides,
oh yes,
you use them in bone healing?
We use this in regenerative medicine quite frequently. And you can look. And the bodybuilders have used them quite a bit in the gyms. Question is, what are they doing? The point I like to say is you want to know where you get these peptides. Remember, peptides are smaller proteins. They're not amino acids, which are the longer chains. These are the shorter chains, and they're involved in many things, including healing. For example, we had a patient who had a tear in the knee, a tear right at the ACL, at the ACL.
Yeah.
ACL. So we were able to help him with peptides and exomes. And so the peptides can do it. Right now I'm trying to work on our lovely Linda, who, just like the rest of us, were the shoemakers running around with holes in our shoes. Why? Because we're too busy to go and stay off our feet and do what we're supposed to do. Now, peptides are not a panacea. It will take time. I have several young men who are in my chair that have had PRP and are now doing peptides and cofactors to really help them heal. And indeed, there are certain peptides that are used in the healing process.
Now, we should go back to lovely Linda, because she's a great person.
Of course.
But she's been walking around with this boot on her ankle. Or
yeah,
her foot.
she has a small fracture in her metatarsal toes.
And still walking on it.
Well, one of the reasons why is because of the clinic, and she won't take the time off to elevate the leg. And I told her on the weekend she better. But the point is, we're now treating her with the peptides, which is something that should have been done months ago. But again, it's only an aid to your healing process, okay? You need to also use the rest, not use it. Same thing with my arm. Everybody knows I broke my arm, but I have a lot of good use with it, as you can see. I use peptides and exomes on a monthly basis or so to keep it up. The point is, you can't expect peptides to be holy water either.
Yes, and you've often said that.
Right.
So this can help you.
Right, and you want to use them judiciously, because guess what? If you use the wrong form, you're not going to get anywhere, and sometimes you can do damage. You and I know. Look, all the muscle heads in the world do this. Yeah. And they make me crazy because they're using the anabolics as well. And we need to help educate, and particularly our young boys. We want to help educate that you can use these things, but you want to use them judiciously and in a good way.
In your case, though, you avoided surgery.
Oh, yes.
Yeah, and that was the goal for you.
Exactly. Well, my age was the reason. I wanted to avoid the surgery based on my age. But again, I certainly do a lot of the physical therapy in terms of, putting muscle mass back on, and it's been a long and arduous process. So this isn't the kind of thing you just walk in and it's a miracle. It's not like that, John.
So, in general, words of wisdom, words today?
Parting words today is God has given us many ingredients. What you want to do is use them judiciously, use them in a wise way with everything else out there that is natural and can be done, along with what? Your pharmaceuticals. I'm never going to tell you throw away your pharmaceuticals or don't get chemo, and certainly I'm never going to tell you if you can get surgery for your cancer, get it out and let us support you. What we do are therapies that can support you live a very high functioning life, high quality life, and really lick your challenge in a way that makes you feel good. Am I curing anything? No.
But you're helping.
Amen.
Okay. And with that, we put the wraps on another edition of Health Watch. Don't forget, operators are standing by at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. 856-489-0505 is the number. 856-489-0505. And don't forget the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show, we replay it this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, Catherine, and Donna, and of course there's fabulous Fran, Joanne, delightful Dee, and our nursing assistants, Sandra and caring Kathy. I'm your host, John DeMasi. Thank you for listening. We'll do it all over again next Sunday, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.